Coconut water was once used as an intravenous fluid. Usage and precautions. Dear friends, coconut water is a popular drink, especially in the summer. It is rich in carbohydrates and electrolytes such as potassium, sodium, and magnesium. Because of these components, many people believe that coconut water can help treat or prevent dehydration. But how accurate is this belief? What are the real benefits of coconut water? And what should we keep in mind when consuming it? The coconut tree works like a natural water purifier. Rainwater seeps into the soil, mixing with minerals and trace elements. The tree's long roots absorb this water and transport it upward through xylem vessels, which function like the tree's blood vessels. Along the way, more nutrients are added through the phloem. When the tree forms a young coconut, a small chamber develops inside, carefully protected by fibers and a hard shell. Into this chamber, the tree deposits purified water, which becomes coconut water, clear, sterile, and naturally rich in electrolytes. In fact, it is like the amniotic fluid that nourishes the coconut flesh. As the fruit matures, part of this water gradually transforms into the white coconut meat. To produce just 1 liter of coconut water, the tree must filter many liters of groundwater. Composition of coconut water. Coconut water is a clear, naturally sweet liquid found inside coconuts. As the coconut matures, the water is gradually replaced by coconut flesh and air. In young coconuts, the flesh is still thin, soft, and translucent, leaving more liquid inside. Coconut water is a popular drink in tropical regions, especially Southeast Asia, the Pacific Islands, and the Caribbean. It is a natural beverage that contains no fat, is low in calories, and is rich in minerals. Young coconut water can serve as an electrolyte solution in cases of dehydration. In certain circumstances, it has even been used as an intravenous fluid substitute when medical saline solutions were unavailable. Main components of coconut water: water, 95.5%, nitrogen, 0.05%, phosphoric acid, 0.56%, potassium, 0.25%, calcium oxide, magnesium oxide, iron vitamins, B1, B2, B3, B5, B6, and C. Coconut water as an intravenous fluid. In special situations, particularly during wartime, coconut water was used as a temporary IV fluid because its electrolyte composition and osmotic pressure are similar to human plasma. The coconuts selected for this purpose had to meet strict criteria: not too old, not too young, containing soft flesh, and clear water that was low in oil and acidity, and free from impurities. They were also sourced from trees grown in clean, open environments, far from livestock, waste, or pollution. The selection was usually carried out by physicians or experienced locals before the coconuts were used for transfusion. Medical use of coconut water. In the past, when coconut water was used for intravenous infusion, a sterile needle was inserted into the soft area near the stem of the coconut to draw the liquid directly into a container without breaking the shell into pieces. Afterward, the coconut was split open for inspection. If the flesh appeared uneven, thick in some areas, thin in others, or if the water looked cloudy, it was discarded. Today, however, With advances in modern medicine, using coconut water for IV therapy is no longer recommended. Instead, sterilized and clinically tested medical solutions are used. Benefits of coconut water. Skin health and beauty. Contains cytokinins that may help improve skin, reduce oiliness, and promote a clearer complexion. Energy and immunity boost. Provides essential nutrients, potassium, and vitamin C to support immunity and overall vitality. Relief in common conditions. May help with dehydration caused by fever, diarrhea, or excessive sweating. Potassium helps the body retain fluids, while vitamin C supports faster recovery. Blood pressure support. Some studies suggest coconut water may lower high blood pressure. Coconut water and dehydration diarrhea may help rehydrate children with mild diarrhea, but there is no strong evidence that it is more effective than oral. Rehydration solutions. Exercise. Some athletes use coconut water after workouts. It does rehydrate, but not more effectively than plain water or sports drinks. Fever. Drinking coconut water may help replenish fluids and electrolytes lost during fever. Precautions. Coconut water cannot replace plain drinking water. Consuming it daily as the main hydration source may cause electrolyte imbalance and affect muscle function. A varied diet with different fruits is recommended. If drinking one coconut daily, other fruits should be reduced to avoid excess sugar and calories. Young coconut water is better than mature coconut water because it contains less sugar, is safer for blood sugar control, and does not contribute to weight gain. For adults, coconut water should be treated as a refreshing beverage, not a substitute for regular water. How much coconut water should you drink daily? It is best not to drink more than 1 to 2 coconuts per day. Who should limit coconut water? People with low blood pressure, those who have just undergone surgery, or individuals with health conditions such as kidney disease or hyperkalemia should consult a nutritionist before drinking coconut water. In Western countries, coconut water is often recommended for children and breastfeeding mothers as it contains monolaurin, a compound that helps strengthen the immune system and protect against colds, flu, and infections. For children, coconut water offers several benefits. Low in calories, cholesterol-free, rich in potassium and fiber, helps reduce constipation, aids digestion, and replenishes lost salts during diarrhea. However, infants under 6 months, only under a doctor's advice, since breast milk remains the most essential nutrition source. Older children, start with about 50 mg for a few days to check for allergic reactions. If safe, it can be added gradually, but should not be given daily. A varied diet is still essential for proper growth. How to consume coconut meat, flesh. Unlike coconut water, coconut flesh is very high in energy. About 100 grams of coconut meat provides 354 kcal, mostly from fats and carbohydrates. Although high in saturated fat, it can increase good cholesterol, HDL, and lower bad cholesterol, LDL. In addition to vitamins and minerals found in coconut water, coconut meat also provides vitamin E, vitamin K, and selenium. However, it should not be eaten daily. Excess consumption may lead to weight gain, obesity, and metabolic disorders. Eating too much can also cause bloating and digestive discomfort. It is best to consume only 1 to 2 times per week. People who should limit coconut meat include those with weakness or poor digestion, pregnant women, people with diabetes, high cholesterol, obesity, patients with atherosclerosis or heart disease.
Is fresh coconut water good for your health, and what should you watch out for? Many people often wonder whether drinking fresh coconut water is beneficial for health. The answer is yes. Fresh coconut water is very good for the human body because it is rich in nutrients, vitamins, minerals, and fiber. It helps strengthen the immune system, lower cholesterol, improve digestion, reduce the risk of cancer, and support heart health. In addition, coconut water can soothe stomach pain, reduce inflammation, and serve as a natural, refreshing beverage. It not only provides hydration, but also restores electrolytes, an energy that the body loses throughout the day. However, like any food or drink, consuming too much can lead to side effects such as weight gain or increased blood pressure. That is why moderation is important. Let's go through the benefits in detail. Boosting the immune system, fresh coconut water is packed with nutrients, minerals, and antioxidants that strengthen your body's defense in several ways. Vitamin C, a rich source that helps produce new immune cells, keeping your immune system strong and preventing common colds. Antioxidants, protect the body from free radical damage and cell breakdown. Minerals, contains potassium, sodium, calcium, and phosphorus, all essential for immune function and overall health. Fiber. Although the amount is small, the natural fiber in coconut water helps maintain gut health, which is closely linked to immune strength. Drinking coconut water regularly can therefore improve your overall health by keeping your immune system strong. Reducing cholesterol. Coconut water also plays a role in lowering cholesterol. It contains fatty acids that are quickly metabolized into energy instead of being stored in the body, helping reduce fat accumulation. It also provides phytosterols, plant-based compounds similar in structure to cholesterol. These reduce the absorption of cholesterol from food, thereby lowering blood cholesterol levels and protecting cardiovascular health. Coconut water and cholesterol. Coconut water contains compounds similar to cholesterol, known as phytosterols. These help reduce the absorption of cholesterol from food, thereby lowering blood cholesterol levels and preventing cardiovascular problems. When free cholesterol in the blood decreases, the risk of high cholesterol-related conditions also goes down. However, moderation is key. Drinking coconut water in the right amount is very beneficial, but overconsumption can lead to weight gain and other health issues. Coconut water and digestive health. Coconut water improves digestion by supplying natural dietary fiber. This fiber supports gut health, promotes bowel movement, and helps prevent constipation. Although the amount of fiber is not very high, it is still beneficial for the digestive system. Additionally, coconut water contains natural enzymes, which support the breakdown of food. For example, it can help with lactose digestion, making it easier for people with lactose intolerance to process dairy products. Still, drinking coconut water incorrectly or excessively may cause digestive disorders or side effects. That's why both benefits and potential drawbacks need to be understood so it can be consumed in the best way. Coconut water and cancer prevention. At present, there is no strong scientific evidence proving that coconut water directly prevents cancer. However, some studies suggest that certain compounds in coconut water may help reduce the risk of specific types of cancer. Cytokinins in coconut water have anti-inflammatory and antibacterial properties. Some research points to a potential role in lowering the risk of colorectal cancer. Coconut water is rich in antioxidants and vitamin C, which protect cells from free radical damage and reduce chronic inflammation, a major risk factor for cancer. That said, preventing cancer requires much more: a balanced diet, regular exercise, and avoiding harmful exposures such as smoking, alcohol, polluted environments, and excessive UV rays. Coconut water and heart health. Coconut water benefits the heart because it contains healthy fats, including monounsaturated fats and compounds, like cytokinins and capric acid. These work to reduce bad cholesterol, LDL, increase good cholesterol, HDL, lower triglyceride levels, which are linked to cardiovascular risk. Furthermore, coconut water provides potassium and magnesium, both of which are essential for maintaining healthy blood pressure and overall heart function. Coconut water and blood pressure. Potassium and magnesium in coconut water help stabilize and maintain blood pressure. However, it's important to note that coconut water also contains a significant amount of sodium, which can raise blood pressure if consumed in excess. For people with hypertension, moderate amounts of coconut water may help lower and stabilize blood pressure, but overdrinking can have the opposite effect due to its sodium content. Therefore, individuals with heart or blood pressure conditions should pay attention to dosage to ensure safe and healthy consumption. In summary, coconut water is good for heart health, but only when consumed in moderation as part of a balanced and healthy lifestyle. Coconut water and pain. Relief. Coconut water can also help soothe abdominal pain, reduce inflammation, and relieve discomfort. This effect comes from its natural anti-inflammatory compounds and organic acids such as cytokinins, capric acid, and caprylic acid, which may reduce pain and inflammation in the body. Coconut water also contains potassium, a mineral that regulates water balance in the body, helping ease digestive discomfort and abdominal cramps. However, if abdominal pain is severe, persistent, or of unknown cause, it is essential to consult a doctor rather than self-treating with coconut water. Coconut water may be helpful for menstrual cramps or mild digestive discomfort, but it is not a replacement for medical care in serious cases. Why coconut water is a natural, refreshing drink. Coconut water is considered a natural, hydrating beverage because it contains natural sugars, minerals, and nutrients essential for the body. It provides energy, replenishes fluids, and supports overall well-being. That said, it should not be consumed immediately after heavy labor or sun exposure. If you are exhausted from heat or physical work, you should rest for 15-20 minutes before drinking coconut water. Drinking it too quickly in such conditions can cause dizziness, fever, or even fainting. The key takeaway: coconut water is highly nutritious and refreshing, but how and when you drink it matters. By consuming it correctly and in moderation, you can maximize its health benefits while avoiding potential risks. Common mistakes. And the next topic. One common mistake is misunderstanding how to properly consume coconut water. Now let's move on to the second topic. Can you drink coconut water when you have a fever or diarrhea? Many people wonder whether coconut water is safe to drink when experiencing fever or diarrhea. The answer is yes. Coconut water can be used as a supportive remedy in such cases. It helps by replenishing electrolytes, minerals, and essential nutrients, while also providing energy when the body is weakened. However, you should drink it at room temperature, meaning freshly opened, not chilled from the fridge. Alternatively, it can be slightly warmed, but never consumed ice cold. When drinking, sip slowly to avoid causing stomach irritation. Important note: if your fever persists despite taking medication, or if diarrhea becomes severe with frequent episodes leading to fatigue and dehydration, you should seek medical care immediately. Coconut water only helps in mild cases. Professional treatment is necessary for more serious conditions. How much coconut water should you drink per day? Recommended dosage by age. The recommended daily intake of coconut water varies depending on age, weight, activity level, and health condition. Adults: 300-500 ml per day is sufficient to gain the nutritional benefits without overconsumption. Children, under 1 year old, not recommended. 1 to 5 years old, 50-100 ml per day. Above 5 years old, 100-200 ml per day. If you are uncertain about the right amount for your specific case, Consult a doctor or nutritionist for personalized guidance. Should coconut water be combined with ginger and rock sugar? In traditional remedies, coconut water is sometimes combined with ginger and rock sugar as a natural health drink. Ginger provides warmth, stimulates circulation, and supports digestion. Rock sugar adds natural sweetness and provides quick energy to the body. This combination has been used for a long time in folk medicine as a way to both nourish and support recovery. Coconut water with ginger and rock sugar. Is it safe? When using coconut water as a natural remedy, combining it with ginger and rock sugar depends on your specific health condition. For people with digestive disorders or diabetes, adding rock sugar can dangerously raise blood sugar levels and harm health. For those with high blood pressure, consuming too much ginger may elevate blood pressure further, which is not safe. Drinking excessive amounts of coconut water itself can also negatively affect people with hypertension. Therefore, using coconut water with ginger and rock sugar is a traditional folk method, but its suitability should always be considered based on individual circumstances to ensure safety. Some people agree with this approach, while others strongly oppose it, believing it is harmless and very healthy. The best way is to receive this information positively, evaluate your own situation, and choose what is safest for your health. Who should avoid drinking coconut water? Coconut water is refreshing, natural, and commonly consumed by both adults and children. However, there are certain groups of people who should limit or avoid it. Those allergic to any component of coconut water should avoid it completely. People with cardiovascular issues or abnormal blood pressure. If you have low blood pressure, drink only a small amount to avoid excessive drops. If you have high blood pressure, consume in moderation, since too much may cause blood pressure. Spikes. Individuals with liver or kidney failure should limit coconut water because of its high potassium content. Infants under 6 months old should not drink coconut water as it may cause kidney function disturbances. People taking medications or undergoing medical treatment should consult their doctor or a nutritionist before adding coconut water to their diet. In conclusion, while coconut water is highly beneficial, knowledge and proper usage are essential. It should not be consumed blindly or solely based on traditional habits. Since every person's health condition is different, safe and mindful consumption will maximize its benefits. If you found today's information helpful, don't forget to leave a like and subscribe for more health insights.